Okay. Good evening, everyone. I am Amrita, and today we are at the week 6 of our live interactive session for the course Maternal Infant Young Child Nutrition. I hope my audio is clear and my presentation is visible. Please give a heads up on in the chat box. Is it clear? Okay, great. Okay. So we won't waste more time and we'll start. Whoever wants to join, they can join. It's already 6:11. So we won't wait anymore and we'll start with our class. So you know the rules. We have 19 questions today again. The previous year assignment questions of week 6. Okay, you may have got current year assignment questions for week 6. I'm not sure about the deadline though. So while you practice those questions, it will be helpful that you practice the previous year assignment questions also, which will be helpful for your exams, right? And also for revising the lectures of week 6. I hope every one of you has attended the lectures of week 6 and have then joined this session. Okay, then only it will be helpful to you. So the drill is that I will be showing you the question and will be giving you 1 to 2 minutes of time, and you can think and answer properly in the chat box. Okay, and whoever is watching the YouTube videos, for them they can keep answering in a notebook, and then at the last you can also count your marks. Okay, here also I'm saying you must note down your marks to see that how many wrong answers you gave and how many correct answers. That will help you in self reflection, right? Okay, so let's start with the first question of the session. Please answer in the chat box. Okay. Okay. In cross cradle hold for breastfeeding, the mother should hold her breast in which shape? From the side in a C shape hold, from underneath in a U shape hold, from underneath in a scissor shape hold, from the side in a scissor shape hold. Please read the question carefully, think, and then answer. Okay? Okay, so today we have a lot of questions about the position of breastfeeding, the holding of breastfeeding, and I think those were the content of this week's lecture as well. So, I hope you all are familiar with the terms. Not many people have joined, so whoever is there, I can definitely know who is answering, who is not answering. Not answering will not benefit anyone, so better be active and answer. Okay. No one knows the answer, or are they still thinking? Is my slide visible? Okay. Is there anyone else who want to answer? Okay. Okay, so let's see what is the correct answer to this question. Correct answer is B. So the correct, so in a cross cradle hold, what is the position exactly that the mother should hold her breast from underneath in a U-shaped hold. Here you can see the diagram as well. You can see there are four positions: cradle hold, cross cradle hold, football hold, and sideline position. So these are different breastfeeding position. In the cross cradle hold, you hold your uh, breast in a cross cradle position, that is in a U-shaped hold, so that the baby is able to suck properly, right? Okay, we'll move on to the next question. In any breastfeeding hold, the mother's fingers holding the breast should be in which direction? Parallel to the baby's lips, perpendicular to the baby's lips, always in the vertical direction, always in the horizontal direction. In any breastfeeding hold, the mother's fingers holding the breast should be in which direction? Parallel to the baby's lips, perpendicular to the baby's lips, always in the vertical direction, always in the horizontal direction. No one knows the answer to the second question, or you're still thinking? Okay, I got an answer A. No one else knows the answer? Not sure. Okay, let's see what is the correct answer. I think I've given enough time. Correct answer is A, parallel to the baby's lips. Okay, so here you can see how in the breastfeeding hold the mother's finger should be parallel to the baby's lips. That way, that is the correct thing to do. Okay, okay. When holding the breast for breastfeeding, the mother's thumb and fingers should always be at what distance from the nipple? 5 fingers, 1 finger, 3 fingers, or 2 fingers. When holding the breast for breastfeeding, the mother's thumb and fingers should always be at what distance from the nipple? Start answering. Okay, is everyone done? Let's see what is the correct answer. Correct answer is 3 fingers. Okay, so the same picture, you have to keep a distance of the ideal distance between the mother's thumb and fingers to hold the breast for breastfeeding is of around 3 fingers of distance from the nipple. Okay, okay. We'll move on to the next question. Which of the following is an early hunger signal of a baby that a mother should look for? Crying, sucking fingers, sleeping, or holding breath. Which of the following is an early hunger signal of a baby that a mother should look for? Crying, sucking fingers, sleeping, or holding breath. A very easy question. Even if you have observed a baby sometime, I think you will know the answer. Right? Okay, everyone done? A very easy question. Let's see what is the correct answer. Correct answer is B. Sucking fingers is an early hunger signal of a baby that a mother should look for to know if her baby is hungry or not. Some of the other signals, like if we discuss all the points to know if a baby is hungry or not, some of the points are licking the lips, smacking or sucking sounds, everything comes under sucking, opening mouth, sticking out the tongue, sucking on anything nearby, or turning head and opening the mouth, or hand towards taking its hand towards the mouth, right? Breathing fast or fussing. Crying is also a statement, but the first signal we see is sucking fingers, right? It is written early hunger signal, so that will be sucking fingers. Okay, so we'll move on to the next question. If the babies go to sleep while breastfeeding, how should the mother wake her up? Gently tapping the sole of the baby's feet, moving the baby's head from side to side, telling the baby to wake up, sprinkling water on the baby. Okay, let's see what is the correct answer to this question. All of you have given A. Yes, A is the correct answer. So if the baby is sleep goes to sleep while breastfeeding, then you can gently tap the sole of the baby's feet and wake her up again. Okay, this is the right thing to do. Okay, we'll move on to the next question. When the baby is deeply attached to the breast, which part of the breast will be in the baby's mouth? Only the nipple and the lower areola, whole breast, or nipple and the upper areola? Think properly and answer. Okay, let's see what is the right answer to this question. The answer is nipple and the lower areola. Here you can see how the baby is sucking to the breast. The While it is deeply attached to the breast, the baby's mouth is sucking the nipple as well as the lower areola of the mother. Okay? Okay. We'll move on to the next question. When the baby opens its mouth widely to breastfeed, where should the baby's lower lip be? When the baby opens its mouth widely to breastfeed, where should the baby's lower lip be? At the nipple, at the border of lower areola, at the border of the upper areola, above the areola? Done? Okay. Let's see what is the correct answer to this question. Yes, at the border of lower areola. So here you can see the lower lip is at the border of the lower areola. Okay. So when the baby opens its mouth widely to breastfeed, the first it touches the border of the lower areola. The lower lip touches the border of the lower areola. Okay. We'll move on to the next question. Which part of the baby should the mother first press into the breast? Baby's nose, baby's chin, baby's forehead, or baby's lips? Start answering. Okay, let's see the correct answer to this question. The correct answer is B. Baby's chin, not baby's lips. Here you can see, so the baby's chin is pressed into your breast and the nose is clear or just touching your breast. The nose should not be pressed into your breast. The baby's chin has to be pressed into your breast. Here you can see the area. This is the breast, this is the baby. Push the base of the hand firmly against baby's shoulder, keeping baby's unburied chin coming in first. So the baby's chin should come first. How will you pull the baby's lips? You have to press the baby's chin so that the lips automatically gets pressed into the breast for proper breastfeeding. Okay? Okay, we'll move on to the next question. Which of the following options is not a sign that a mother should look for to check whether the baby is deeply latched to the breast? Read this question properly. Which of the following options is not a sign that a mother should look for to check whether the baby is deeply attached to the breast? Baby's mouth is wide open. An equal part of the areola is seen near the upper and the lower lip of the baby. Baby's lower lip is curled in the outward direction. Baby's chin and lips are deeply embedded into the breast. Read the question properly. What it is trying to ask exactly. Read the options properly and answer. Okay? Done? Okay, let's see. The correct answer is B, not D. An equal part of the areola is seen near the upper and lower lip of the baby. That is the ideal condition, right? If I show you the figure, yes, this. Here you can see an equal part of the upper lip and the lower lip. Equal part is attached when we compare the upper and lower lip. That is the ideal condition that your baby is deeply latched to the breast. So in that condition, you don't need to check for if the baby is properly breastfeeding or not. And the rest three options were Yes, baby's mouth is wide open. Obviously, that is the condition you have to check. And baby's lower lip is curled in the outward direction. Obviously, that is also not deep latching. So you have to check baby's chin and lips are deeply embedded into the breast. That is not also the ideal condition. So you need to see that it is proper. The upper lip and the lower lip of the baby are sucking the equal part of the areola, that is the lower areola as well as the nipple, and they are in an equal position so that it is properly latched to the breast. Okay? Okay. We'll move on to the next question. When are the baby's rapid growth periods in which the mother should breastfeed more often? More often. Sorry. 1 week, 2 weeks, 4 months, 2 weeks, 6 weeks, 3 months, 3 weeks, 6 weeks, 6 months, 3 weeks, 4 weeks, 4 months. When are the baby's rapid growth periods in which the mother should breastfeed more often? People who are joining late can start from the question it is going on, and you can go back and watch the recordings in the YouTube channel. Okay. हेलो. अ, भैया मुझे तेलुगु नहीं पता. अ, भैया मैं हॉस्टल आ गई हूँ. सुबह नहीं आया. LH9 आ सकते हैं क्या? LH9 नहीं पता आपको? भैया मैं नहीं हूँ अभी लैब में और कोई नहीं है शायद. अभी अचानक से कहाँ से ढूंढूं? आप सुबह आइए, थोड़ा शाम को तो मैं चली आती हूँ लैब से ना. अच्छा आप 1 मिनट रुकिए, मैं पूछती हूँ थोड़ा. ठीक है. हेलो. आप कितनी रूम में आ गई हो क्या? अच्छा अच्छा, थोड़ा बाहर जाओ ना, वो राउटर वगैरह आया है शायद. अमेजोन. आई थिंक 2-3 चीजें आई होंगी, ले लेना सब. ठीक है. ठीक. हेलो. हाँ हाँ हाँ, आ रहा है भैया, आप वेट कीजिए थोड़ा, 2 मिनट में आ रही है वो. OTP. 319660. हाँ. एक लड़की आ रही है आकृति बोल के. ठीक है ठीक है. Okay, let's see what is the correct answer to this question. Sorry for the interruption. Got a call. Okay, so the correct answer is B. 2 weeks, 6 weeks, and 3 months. हेलो. ओके ओके. एक ही है. ठीक है, जो भी है ले लो. तीन आने वाले थे आज. ठीक. Okay, okay. Really sorry for the call. Okay, so the correct answer is B. Okay, 2 weeks, 6 weeks, and 3 months. So your baby will go through many growth spurts in the first year. They can cause your baby to nurse longer and more often. So during these growth spurts periods, like what is it? 2 to 3 weeks first, then is 6 weeks, then is 3 months, then is 6 months. So if we go by the sequence, it should be starting with 2 weeks, then 6 weeks, then 3 months. Okay, so in these period, the breastfeeding of mother is really important for the growth of the baby, because these are the rapid growth periods of your baby when it needs breastfeeding more often as compared to other periods. Okay, so the correct answer is 2 weeks, 6 weeks, and 3 months. Then comes 6 months. So C option or D option is incorrect. Okay, I hope you all agree. Okay, we'll move on to the next question. Which of the following happens during nipple feeding? Nipple gets rubbed onto the hard palate of the baby's mouth. Nipple gets rubbed onto the soft palate of the baby's mouth. Baby latches onto the lower areola. Baby gets more milk from the larger milk ducts beneath the areola. Can start answering. एक ही पैकेट दिया क्या उसने? तीन चीजें होंगी. देखो, राउटर एक होगा, एक A4 शीट्स होंगे, और एक मैंने लैपटॉप कवर ऑर्डर किया था. ओके. Please read the questions properly and answer. I can see many people are giving wrong answers. So, to avoid that, please read the questions properly and answer it. May be confusing because the options are somewhat similar, and or if you people have not attended the lectures, I'm not sure about that too. Okay. Okay, there is no harm in giving wrong answers, but now when we are discussing the correct answers, please keep the points in mind so that you don't repeat the mistake again. Doing a mistake in this session is not a problem, but to get but for the exams and for your own knowledge, you should be clear about these terms and points as well, whatever we are discussing today. Okay? Okay, is everyone done? Okay, some people are still giving answers. I'll wait for 1 minute more. I request everyone that please, uh, लो, हाँ, दो A4 शीट्स वाले है ना? हाँ, ठीक है। मेरा वेस्टर्न चल रहा है ना? अच्छा, हाँ हाँ, ठीक है। Okay, okay. So let's see what is the correct answer to this question. Correct answer is A. Nipple gets rubbed onto the hard palate of the baby's mouth. So if you read the question properly, it is written as nipple feeding. Nipple feeding is different from breastfeeding. Breastfeeding is what we all people answered in the previous questions, right? The baby sucks the nipple as well as the lower areola. So when it is only sucking the nipple, what happens? Nipple gets rubbed onto the hard palate of the baby's mouth. So if you see, this is the hard palate, this is the hard palate soft palate junction, this is the nipple tip. So when he is only sucking the nipple and not the areola, what happens? The hard palate of the baby's mouth is rubbed onto the nipple of the mother. Okay, so A is the correct answer. Okay, I think someone has given A as the correct answer. Good. Okay. How wide should the baby open its mouth before the mother puts the breast in it? How wide should the baby open its mouth before the mother puts the breast in it? 30 to 60 degrees, 90, 60 to 90 degrees, 90 to 120 degrees, or 120 to 160 degrees. A very easy question and direct question. Start answering. Think properly and answer, but this is a very general question. I think you all can give it. Please think properly and answer. How wide should the baby open its mouth before the mother puts the breast in it? Okay, so you all are saying 30 to 60 degrees. A, is it? I don't think so. The correct answer is 120 to 160 degrees. Okay, how should I explain this? Okay, 1 minute. See. Yeah, right. So take a pen and explain. So you all are saying 30 to 60 degrees. How much is 60 degrees? This much? An acute angle, right? So will so if this is the baby and this is the mouth, so will this be enough so that it can deeply latch on to the breast? No. The opening should be at least this much so that it can properly breastfeed, right? Here also you can see the yes, here only you can see the opening of the baby, how it is opening so that the mother can put the breast. This is not 30 to 60 degree, but this is around 120 to 160 degree. Not exactly 180 degrees, that will be a straight line, but approximately from 120 to 160 degree. The baby's mouth should be that wide open to suck the nipple and the lower areola properly. Okay. So I hope you all agree. Okay, I hope you all are learning new things today. Okay, okay. We'll move on to the next question. When the baby opens its mouth widely to breastfeed, where should the baby's upper lip be? Okay, just a minute. Okay, yeah. When the baby opens its mouth widely to breastfeed, where should the baby's upper lip be? At the nipple, at the border of the lower areola, at the border of the upper areola, a little above the nipple. I hope you all are agreeing with the correct answers which we are discussing today, and please keep those points in mind so that you don't repeat the same mistakes in the exam as well. Okay? Okay. Okay, read this question properly and answer. When the baby opens its mouth widely to breastfeed, where should the baby's upper lip be? At the nipple, at the border of the lower areola, at the border of the upper areola, a little above the nipple. Students who are joining late, I request please be on time. The timing is 6 o'clock, not 6:30. 6 p.m. is the timing, not 6:30 p.m. So if you all start, if we can start early, we can end early as well. So you can do your rest work, whatever you have, and we can discuss the questions in a more elaborate manner. And you will be active throughout the session. You can give the answers in these live sessions, or else you have to go back and watch the recordings. Right? So please be on time. Okay. Okay, I think everyone knows the correct answer to this. The correct answer is a little above the nipple. Now we have discussed a lot of questions regarding the position of the breastfeed and nipple feeding as well, and the lower and upper lip positions of the baby while breastfeeding. Right? Okay. 14th question. If dimples appear in the baby's cheeks while breastfeeding, which of the following options is not true? Baby is nipple feeding, more of upper areola is in baby's mouth, baby's jaw is slowly and distinctly dropping down while swallowing milk, baby is too far from the areola. Okay, start answering. Okay, let's see the correct answer to this question. Baby's jaw is slowly and distinctly dropping down while swallowing milk. In that case, dimples won't form, and but the other three cases, baby's nipple feeding, more of upper areola is in baby's mouth, or baby is too far from the areola. In all of these cases, dimples can appear in the baby's cheeks while breastfeeding, but C option is not correct. While slowly it is, if the baby's jaw is slowly and distinctly dropping down while swallowing means that means what? That the hold is becoming loose. In that case, you won't see the dimples in the baby's cheeks, but in the rest three cases, you can see the dimples in the baby's cheeks while breastfeeding. Okay? Okay, we'll move on to the next question. How will the mother know if she should continue feeding the baby from the same breast? If thin watery milk comes out of the breast, or if there is a good flow of thick milk on expression, if 5 drops of thick milk come out on expression, if no milk comes out on expression, if 3 drops of thick milk come out on expression. A easy question, a really easy question. Try answering it. Okay, let's see what is the correct answer to this question. Correct answer is A. I think everyone has given the correct answer. Yes, first a thin watery milk will come out of the breast upon expression, and then a good flow of thick milk will come. So if this is happening, you can continue feeding the baby from the same breast from which the thin and the thick milk has come. Okay, we'll discuss about what is thin watery milk, what is thick milk. We'll discuss in the upcoming questions. Which of the following is not correct in the position of the baby's body during breastfeeding? Baby's ear, shoulder, and hip should be in straight line. Baby's stomach should gently press against the mother's chest. Mother should support the baby's entire body. Nair of the baby's nose should be above the mother's nipple. Remember, this is asking not correct. Okay, not correct. Start answering. Okay. Let's see what is the correct answer to this question. Correct answer is D. Good. Everyone has given the correct answer, I think. Nair of the baby's nose should be above the mother's nipple. This is a wrong statement. Instead of the nose, the chin should be touching to the skin of the breast. That is the ideal condition or the ideal position. The nose should not be touching the mother's nipple. The nair means the tip of the nose should not be touching the mother's nipple but the chin. Right? Okay. Chin to the skin, not the nipple. Okay. Let's move on to the next question. The mother brushes her nipple on the baby's upper lip for more than 10 minutes, but the baby doesn't open its mouth widely. What does it mean? Mother should nipple feed. Mother should forcefully open the baby's mouth. The baby is not hungry. The baby wants formula. A very easy question. Yes. Yes, yes. C is the correct answer. The baby is not hungry. That's why even when the mother is trying to brush her nipple on the baby's upper lip for more than 10 minutes, the baby is not willingly opening its mouth, which is the indication that the baby is not hungry for now. Okay. Okay, we'll move on to the next question. The mother is breastfeeding regularly, but the baby is not growing well. Which of the following could be a reason for the baby's poor growth? Mother is feeding very frequently. Mother's milk is not enough. Mother is not feeding both fore milk and hind milk from one breast completely. Mother is not giving formula. Start answering. Think properly and answer. Okay, let's see what is the correct answer. Correct answer is C. So, what is fore milk and hill milk? So before that, I think we all know what is colostrum. Colostrum is the first milk from the breast which is taken by the babies. Colostrum is the first food, perfect first food for the babies, and these first feedings may only be a few teaspoons, right? Not much, but few teaspoons, and they contain a lot of antibodies. One of the antibodies is IgG, and like it all breast milk, its color is different as well. Next comes the fore milk, which is the thin milk, which first comes in the beginning of the breastfeeding session. It helps to quench the baby's thirst and contains plenty of lactose and proteins, but very little fat and few calories. So only fore milk won't be enough. So after once fore milk is given, next will come the hind milk. So to do this, you should be feeding from the same breast. If you change breast, again fore milk will come from the next one, right? So you shouldn't be doing that. So one from one breast you can start, right? So hind milk is received at the end of the breastfeeding session. So contains it contains more fat and calories. You can see the color is different in the different parts, right? Your baby needs both fore milk and hind milk for overall growth and development. Therefore, a baby should finish feeding each breast before moving to the other. So, a baby should first finish with one breast and then should be moving to the other breast. That is the correct technique. Okay, so option C is correct. So, this is the last question of the session. Baby is nipple feeding. What should the mother do? Let the baby nipple feed. Put her clean little finger in the baby's mouth to detach and relatch properly. Pull the nipple forcefully from the baby's mouth. Pull the baby's head forcefully away from the breast. Start answering a very easy question, common sense wala question. Okay. Please read the question properly. Read the question properly and answer. Is A the correct answer? Really? Is nipple feeding good for the baby? Is it? Is it? You people think so? How can A be the correct answer? Baby is nipple feeding. It is not actually deeply latched to the breast. So why would you let the baby nipple feed? The correct answer is, sorry, B, not D. This is typo. The correct answer is B. Put her clean little finger in the baby's mouth to detach and relatch properly. The correct answer is B. You can put your clean little put her clean little finger in the baby's mouth first so that it will leave the nipple and then detach and again relatch it properly so that you can now second time you can relatch it properly so that it is sucking the nipple as well as the areola. Only nipple feeding won't give that much of a, it won't be able, the baby won't be able to suck that much of the breast milk what it is supposed to do, right? So the first option is incorrect. It should be B. I have written D. Sorry for that. That is a typo. B is the correct answer. Okay. No, you have to just means the baby is nipple feeding. So how will you stop that? To stop that, you can gently put its little finger in his mouth and then detach it and again relatch it properly with the breast so that now it is sucking properly and not nipple feeding. Understood? The finger wala thing is just to detach it. Okay? Okay. Okay. So I think today students have given a lot of wrong answers. That's totally okay. Giving wrong answers is totally fine. But I'm happy that you all were active throughout the session. You were giving the answers according to your opinions. That is correct. But I think today a lot of things must have been corrected in your mind as well. So please follow that. If you have confusion at some point of time, then please go back and watch the lectures of week 6 again. Okay? First question and sixth question. Okay, let me see. Sixth question. Okay, the correct answer is B. And the first question is B again. Is it clear? Yes. I was about to ask what is your score out of 19? I don't think anyone has got full marks today. Okay, Shruti, you can, I will record, I am recording this session. I will upload the session in the YouTube channel. You can go back and read and revise all the questions again rather than seeing here for some time. Is it okay? I will upload the recording in my YouTube channel. I think you all you all are getting links. What we'll do for the next class? Week 7 previous year assignment questions. For that you need to watch the week 7 wala lectures and come. Okay? With a new set of questions for week 7 lectures. Okay? Yeah, you all need to watch the lectures. Then only you can give correct answers, right? And that is really important from the exam point of view as well. These questions are for practicing, but you can only practice when you know the concept properly. So, to know the concept, please watch Rupal ma'am's lectures and come to this session. Okay? Okay. Only one person shared. Rest all, you didn't count. What is your mark out of 19? What is your marks? No one wants to share? Okay, then should we disperse? Should we end the class today here? Okay, then we'll end the class here and we'll meet again next Tuesday. Please remember the timing is 6 p.m., not 6:30, not 7. Okay? Please be on time so that we can start at time and end at time. Okay. Okay, everyone. Thank you. Thank you. We'll meet next Tuesday.